for these sessions for us. Tia's done a really fantastic job for the last 2 sessions, but unfortunately couldn't be with us today. And I'm very conscious that I have big shoes to fill. I also wanted to let you know that the session will be recorded today and will be made publicly available on YouTube after the event. I'll provide more details about that at the end. Before we get started, I'd like to acknowledge the traditional owners of the land from which I'm joining today, the Turrbal and Jagera people of the Meanjin Nation, commonly known as Brisbane in Australia. I acknowledge their elders, past and present, and their ongoing connection to land and waters. I'd also like to acknowledge the traditional owners of the lands from where you are all joining today. A warm thank you to everyone for joining us online. Today's event is the final session in a 3-part series on making social protection more adaptive and responsive to shocks and climate change. The previous session featured fantastic speakers from across the region, including representatives from governments and non-government organisations from Fiji, Tonga, Kiribati, Vanuatu, as well as from regional organisations. As a quick recap, the first session provided an overview of adaptive or shock-responsive social protection, and the second session looked more closely at the key elements or the building blocks that we use to make social protection adaptive and shock-responsive. Today, we're going to consider the future of climate-resilient social protection and disaster financing in the Pacific, and we have another really great lineup of speakers from across the region to help us. The session will explore key linkages between social protection and climate change and how these intersect with disaster risk financing and how social protection can support disaster and climate resilient development. We'll also share country experiences and emerging discussions from across the Pacific, especially the role of integrated policies and programs that link social protection, climate change and disaster response. The session this morning is all about sharing and learning from our speakers and from each other to build understanding and to explore the opportunities for collaboration in this space. We'll have a few questions along the way. Please feel free to post your questions and comments at any time in the chat during the presentations. We'll also have time at the end of the session for more questions and discussion, hopefully about 20 minutes. I'd really encourage you all to stay online for this. I know it can sometimes be tempting to jump off after the last speaker finishes, but if you can stay online, I really encourage you to. I usually find the question and answers session at the end of sessions like this is where the really interesting exchange of information happens and where we learn a lot from countries who aren't presenting also. I will do my very best to get us finished on time in an hour and a half, give or take a couple of minutes. So enough from me, let's get started. Our first speaker today is Jessie Doyle. Jessie's a colleague of mine and our Senior Social Protection Specialist with Partnerships for Social Protection. Jessie will discuss how social protection and climate change fit together, drawing on insights coming from research that P4SP is currently undertaking on this topic in the Pacific. Over to you, Jessie.
Great, thanks a lot, Rach. And it's great to see you all online. A huge thanks to PIFs for hosting this series and to the WFP team for co-organising this session as well. So as Rach flagged, what we're really hoping to do with this session is to zoom out a little and to speak to the role that social protection can play, not just in responding to shocks, but also in addressing the broader climate challenge facing the Pacific. So this presentation is just a bit of a framing to lay the groundwork for some of the more concrete examples that Maeva, Lotu and Nitesh will speak to in the presentations that follow. And next slide. But before I dive into this framing, I think it's worth just setting the context for where some of this recent thinking on climate resilient social protection has emerged from. So back in 2023, DFAT published this study that was led by Cecilia Costello and Anna McLeod on rethinking the role of social protection and climate change in the Asia-Pacific region. And the study effectively argued that social protection systems as we currently know them need to be reconceptualized to not only respond to shocks and disasters, but also the longer term transformations that are being brought on by climate change. And with that framing in mind, they mapped out 5 main functions or roles that social protection can play. And then over the past year, our P4SP team has been working on a follow-up study that looks into how climate resilient social protection applies to the Pacific more specifically, and the relevance of these 5 functions in this particular region. And next slide. I think, when we're talking about social protection, it's really important to be clear on the definition that's being employed. In a broad sense, what we're talking about are policies and programs that are aimed at preventing or protecting all people against poverty, vulnerability, and social exclusion throughout their life cycles. So whilst these systems are available to all, there is really an emphasis on vulnerable groups. And I think it's worth noting that social protection is also the broadest possible framing. But in the Pacific, you might be familiar with slightly narrower framings and terminology that's more readily employed, such as social security in the North Pacific countries for programs covering formal workers, or social welfare in countries like Fiji and Nauru that have standalone social welfare departments. And next slide. So in the context of this upcoming P4SP study, the scope of the report picks up on both what is coined as social protection, but also on other cash-based initiatives as well. So the main focus is really on those government-led social protection schemes. And if we look at the core pillars, we're thinking about things like social assistance, that includes different forms of transfers, public works programs, fee waivers, subsidies, but also social care services, social insurance programs, and labour market policies and interventions. Then there's also some discussion of community and family-based support systems, which are not government-led, obviously, but they're still part of broader social protection systems and are particularly critical in the Pacific. And in many places, I think it's worth noting that they're actually the main form of support. And then lastly, we cover development and humanitarian partner-led programs, which are often not considered social protection, but are also essential in providing support for climate resilience around the region. And next slide. So what is the climate challenge facing social protection systems in the Pacific? It's a combination of different factors, but I think at the heart of it is the fact that existing systems have primarily been designed with life cycle risks rather than climate risks in mind. And we know that climate change is already increasing hardship and vulnerability in the region, and that's predicted to significantly worsen. And with that, both government-led and community and family-based systems will be put under immense strain. So the pressures are real, but I think with that, there are also opportunities for social protection systems to play a role in addressing the climate challenge. And we want to speak to some of those. Moving on to the next slide. So what are these 5 functions that I've spoken about that social protection can potentially play that are mapped out in this framework? The first one is one that will be very familiar to this audience, and that is responding to climate shock. So basically helping people recover quickly from extreme weather events. And this is really focusing on using social protection programs to temporarily scale up support when a crisis strikes. The second one is around reducing the vulnerabilities to climate change. And the thinking here is that social protection programs can reduce people's vulnerabilities before climate shocks actually happen. So basically by providing steady income support. The third is around enabling adaptation options. So using social protection to incentivize people to make climate smart choices. So under this sort of function, you can think of things like public works programs that support community adaptation, or even support for livelihoods diversification. The fourth one is just playing some role in reducing greenhouse gas emissions and supporting carbon sequestration efforts. So the one that's sort of flagged in the study primarily is around public works programs that might restore mangroves or forests, for example. And then the last function there is just on assisting the green transition. So as countries phase out of fossil fuels and impose carbon taxes, some groups will lose income and face higher prices. And this is really about compensating those groups through social protection programs. And next slide. So what we've done in this study is to map out how relevant each of these functions are for the Pacific countries. The first 2 functions are considered as being very high in relevance, just given that many Pacific countries have invested significantly in strengthening their social protection systems for both routine transfers and also for shock response. And we've seen this particularly in Fiji and Tonga in recent years. The third function is listed as being high rather than very high, just given that many of the adaptation programs are still pilot programs or project-based rather than being fully institutionalized. The function around contributing to mitigation efforts ranks as moderate in relevance, just given we haven't really yet seen these efforts linked with social protection programs at scale. And then the last function on offsetting transition impacts is considered as being lower on the scale of relevance, just given that many of these countries are not high-emitting countries and social protection programs are not currently geared towards supporting that just transition in the Pacific, at least not at this point in time. And things may change moving forward. And next slide. So I think, having said all this and recognizing that some of these 5 functions are more relevant than others at this point in time, I think that it's worth noting that there are really interesting examples to draw on across the Pacific for all 5 of these functions. So on the first function, we've seen Fiji and Tonga really lead the way with the adaptive and shock responsive agenda. Many countries have permitted drawdown options for Provident Fund members to respond to shocks, I think starting with Vanuatu with TCPAM. And then there are also solid examples of cash for work programs, and more recently, a lot of work being done around these anticipatory action pilots, which aim to trigger payments ahead of a shock. Then on the reducing vulnerability and adaptation functions, we've seen a lot of work around strengthening core social protection systems, but also interesting projects on skills training for building climate resilient homes, as well as projects geared towards facilitating climate-induced migration and relocation in Fiji and Vanuatu. And then on the mitigation and green transition front, we've seen cash for work programs linked to tree planting, albeit at a relatively small scale, but also payments for ecosystems programs in the likes of Fiji and Vanuatu. And next slide. So I guess, we wanted to touch on the financing approaches and how these can potentially contribute to these climate resilient social protection programs. This is obviously a DRF learning session. And so we also wanted to touch on, I guess, how the role of DRF might differ from climate risk financing and loss and damage funding. So disaster risk financing is obviously focused more on the short-term event-driven financial protection. And the way that it's sort of framed is clearly around providing liquidity for response, recovery, and reconstruction. And I think it'd be fair to say that it's really this DRF approach that we're seeing most clearly applied to financing social protection in the Pacific out of these sort of 3 buckets. The next is climate risk financing. This is longer term and primarily geared towards mitigation and adaptation efforts, addressing climate change. And then lastly, and sort of sitting slightly apart, is the loss and damage funding, which is set aside for those instances where mitigation and adaptation are no longer an option, and the impacts of climate change are clearly unavoidable or irreversible. Obviously, with each of these financing approaches, there's a corresponding set of financing instruments, which are mapped out in this table. But I won't go into these in detail because many of them will be covered in the presentations that follow. But I did just want to touch, I guess, briefly on the suitability of each of these approaches to climate resilient social protection. And next slide. Sorry, Kate, could you just move on to yeah, thank you. So just in terms of the suitability, we see disaster risk financing and loss and damage funding as primarily being geared towards functions 1 around responding to climate shocks. So the disaster risk financing instruments enable governments to scale up social protection programs immediately after, or ideally even before a climate shock hits. And then loss and damage funding could support social protection in context of severe or irreversible shocks where the impacts are considered to be sort of much longer term. We then see climate risk financing as being well suited to support functions 2 through to 5. I think it's just worth flagging that this is really like a simplified framing, and in reality, there might be cases where the lines are slightly blurred, but this is just intended to help understand where each of these financing approaches could potentially plug into this climate resilient social protection framework. And next slide. So just to wrap up, I guess, I wanted to touch on some of the core considerations moving forward in this space as they link to financing as well. I think sort of one, is that at the very heart of climate resilient social protection is this agenda around strengthening core social protection systems. And this is something that Pacific countries are already investing heavily in, and that we see day to day with the work that we do with P4SP. But given this is an emerging angle for social protection systems, I think there are also many questions that remain around the role of financing, including how these different financing approaches should be defined in national strategies. I think there's a question of how to layer these financing instruments. Obviously, a lot of thinking has been done on the DRF side, but how does that fit in with climate risk financing and loss and damage funding as well. And then I think there's perhaps one around which programs are best placed to serve as delivery channels for these different sources of financing too. So I'll stop there, but hopefully that's provided a bit of a useful framing for the presentations that will follow. So thanks for listening in, and back to you, Rach.
Thanks so much, Jesse. And can I just say, I think you did an amazing job of simplifying or trying to simplify some really complex and confusing concepts, even I think for people who work a lot in that space, particularly around the distinctions between loss and damage financing and how that fits into the picture. So thanks very much, Jesse. And I'd also mention that Jesse very kindly stepped in. One of the partners who are authoring the study for us, Talanoa Consulting in Fiji, had hoped to be able to present, but they are both all traveling at the moment. So really appreciate, Jesse, you stepping in to present on their behalf. Jesse, one of the questions that I have, and it kind of picks up on your last point, I guess, around some of the questions or gaps or unanswered issues we still need to tackle. One of the things I notice is we seem often in the Pacific to be having two separate conversations, and bringing the conversations together sometimes isn't happening. So, there's a lot of conversations going on in the Pacific around climate change. Obviously, it's such a pertinent issue. And there are lots of discussions, particularly at a national level, around the role of social protection. But it seems to me that bringing those conversations together is still a bit tricky. And social protection isn't always on the radar of, or isn't often on the radar of climate people. And similarly, climate change is increasingly on the radar of social protection, but sometimes there's a gap there. I'm wondering, Jesse, if you can talk to that, or I'd be keen to hear your reflections on why that might be the case, do you think?
Yeah, thanks so much, Rach. I think it's a really good question, and it's something we're seeing, obviously, not just in the Pacific, but across other regions as well. And I think sort of the main reason that the two sectors remain quite siloed is that they've evolved under very different mandates and institutional homes. So, we look at social protection as sort of typically sitting under ministries like Women's Affairs, Social Welfare, or Labour, with climate change sort of tends to be led by environment or disaster management agencies, often reporting through quite separate policy and financing channels. I think something that's flagged in this draft report is also that there's no single regional home for social protection in the way that SPREP or SPC coordinate climate work. So it doesn't really have the same visibility in regional climate and resilience frameworks. And then one that we've reflected on over the years is that the two sectors often speak slightly different languages. So climate actors often talk about adaptation, mitigation, resilience, whereas in social protection, we focus on poverty, vulnerability, inclusion. And I think that makes collaboration less intuitive in some cases, even though those linkages are often there. And then on top of that, which is something, again, that's sort of picked up in this work that's been done through the Anna McCord and Cecilia Costello paper, and the one that we're working on, is that financing systems are often quite separate. So climate funds like the Green Climate Fund are hard for social protection ministries to access. And domestic welfare budgets are rarely tagged as climate related. And so in small administrations with limited capacity, just keeping the core programs running can make it really difficult to carve out that time that's needed for joint planning. So what you get is a lot of sort of well-intentioned but quite partner-driven pilot projects, rather than the kind of long-term system-level integration that would really bring the two sectors together.
Yeah, thanks, Jesse. Yeah, lots of factors, hugely complex. Really appreciate your presentation today, Jesse. Before we go to our second speaker, I'm really keen to get a photo of everyone who's joined online. So if I can ask people really quickly to turn on your cameras, if that's okay, both participants who are joining us and our speakers, and we will take a couple of quick photos, if that's okay, before we move on to our next speaker. Thanks, everyone. Atishma and Kate, I'll leave it to you to work out how we see everyone.
I actually don't know that we can because it's being set up as a webinar. So I think we can screenshot ourselves, but good intentions, but I think it's failed.
I'm really sorry, everyone. Yeah, it would have been lovely to see you all. Apologies for that. We will work out how we do that for next time, perhaps. But thanks, everyone. On that note, there is nothing stopping us going straight on to our second speaker, who is Maeva Magmui. Maeva is the Principal Sector Analyst, Governance and Leadership with the Government of Vanuatu. She's also the Vice Chair of Vanuatu's National Comprehensive Social Protection Policy Task Force. As some of you know, Vanuatu has recently developed an adaptive social protection policy and is currently developing a social protection policy. Maeve is going to share with us Vanuatu's story, including their motivation for developing these strategies, their experience with disaster risk insurance, and what's next for Vanuatu. Maeve, the floor is yours. Thanks.
You're on
Sorry,
mute,
Maeve. I think you might be on mute. Maeve?
Okay, sorry about that. Thank you, Rachel. Thank you to WFP as well as P4SP for collaborating on organizing this learning series, and especially for choosing Vanuatu to be the case study for this learning series, and appreciate that. I'm representing the Vanuatu government in just sharing what we are currently doing in the space of social protection, although it's very new to Vanuatu, but I'm glad that we are progressing in this space for our vulnerable group, as well as for the betterment of the countries, especially in the well-being of our people. Next slide, thank you. Yeah, so as we all know, Vanuatu is assessed as the most exposed country to natural disasters in the world. It represents one of its most significant development challenges, and our country is exposed to a variety of both hydrometeorological and geophysical disasters. So that means we experience tropical cyclones, floods, droughts, geophysical hazards that includes volcanic hazards, earthquake-related hazards, and tsunamis. In 2020, the country faced Category 5 tropical cyclones, Harold, which caused an estimated $617 million US, or about 61% of our 2020 GDP in economic impacts. Our country continues to face triple shocks with severe negative impacts, and especially affecting our vulnerable and disadvantaged segments of our population as well. First, we have the compound impacts of Tropical Cyclone Harold, which is a Category 5 cyclone, as well as the COVID-19 pandemic during April of 2020. And then we have the global crisis of food prices caused by the different wars that's happening around the world, especially between Russia and Ukraine. And also we have tropical cyclones, Judy and Kevin, both Category 4 cyclones that causes landfall over Vanuatu on the 1st and 3rd of March of 2023, and which affect at least 271,000 people, which is about 82% of our country's population. While many of the countries, especially in the region, already adapted and already, in the wave of social protection, Vanuatu is still very new to social protection, especially, we have our concept of social protection, which is embedded in the values of our society, where mutual respect, sharing, cooperating between foundation of our network of informal or community-based safety nets among our population. But these mechanisms are still, affected when they could be limited when we are faced with the whole community are faced with, different types of shocks like natural disasters. So because of this, the Vanuatu government had started a national policy dialogue with the World Bank, and we have developed the adaptive social protection policy last year. So these are the driving force, our country's exposure to natural disasters, as well as the hardship of our people, of going through the impacts of these disasters, as well as the other shocks, COVID-19 plus the other compound shocks that we have. The government has decided to develop a policy that will help the vulnerable groups in our society. So we also have the National Disaster Recovery Framework, which ASP is an instrument that we think will help to support our country in achieving our national sustainable development goals for 2016 to 2030 as well. And so these are the driving force behind Vanuatu developing the adaptive social protection policy. Next slide. So the main challenge for establishing the ASP, or the adaptive social protection system in Vanuatu, is we don't have formal safety net programs and data information systems to reach people in hardship. Currently, there are no permanent or transitory government safety net interventions in the country that aims to enhance the resilience of our people in hardship, and such as cash transfers or livelihood creation diversification programs. In addition, there's also no database or information system in place to identify and underpin operations to reach people in hardship or in post-disaster scenarios. Historically, shock response activities from disaster risk management sector have concentrated in immediate humanitarian service for the affected population, while the government implemented a financial stimulus package in 2020 to address the compounding effects of Tropical Cyclone Harold and the COVID-19 pandemic. It was targeted at business houses, but not vulnerable groups. The Vanuatu National Provident Fund is the main provider of a sort of formal social protection in the country. It is a contributory pension fund that is mandatory for people in only the formal sector, and is optional for those in the informal sector. The National Provident Fund records its members will form about 68% of the adult population, but does not have the national ID number or any information on the household status or vulnerability. VNPF has bank account numbers for about 80% of its members, but has no records on non-members. So after TC Harold and COVID-19, VNPF implemented an assistance strategy for its members, which include a simplified process for members to release funds from their medical and investment sub-accounts, and a scheme for hardship loans. The wider social protection has been ad hoc and small scale. For example, in response to COVID-19, Oxfam implemented a cash transfer program that reached about 4,000 vulnerable families by providing a monthly cash transfer of about 7,000 Batu, or $600 for 6 months, complementing existing informal protection networks that we have in country. So another example is the Save the Children that distribute regular payments to 250 households with disabled children using digital wallets. Next slide. So the National Adaptive Social Protection Policy was developed under the guidance of Vanuatu Social Protection Task Force based on evidence that we collected from risk and vulnerability assessments and work by the government of Vanuatu and the World Bank. And the main objectives of the adaptive social protection are to protect vulnerable population from falling deeper into poverty due to disasters, shocks, and whatnot, and build resilience by providing timely and appropriate support through programs to mitigate the immediate impacts of shocks, and also to support intersectoral collaboration and integration to optimize resources, improve data collection. And there are 5 strategic interventions in this policy. One, leveraging existing and future social protection programs. Secondly, to design and implement emergency cash transfers or community cash for work programs. Third, develop an ASP database to collect and maintain data on the vulnerable population, as well as strengthen early warning systems and secure earmarked disaster risk financing. So that's in 2004, last year, that we actually launched this policy. And we are still working on developing the other components of the policy. Next slide. So, so the adaptive social protection policy has 4 key blocks that we are working on. So the programs and delivery, at this point, they are nascent, or we have some sort of programs that are going on, but they're not really categorized as social protection or adaptive social protection programs. Data and information is same thing. We don't have a unified social registry or ASP database. We also have a financing. We slowly emerging on the area. We have disaster risk financing policy that's been established. Institutional arrangement that's also in discussion at the moment. So we are working on all these different components of the adaptive social protection policy to get it up and running. Thank you. Next slide. So the payment systems and delivery channels, the banking network outside Port Vila and Luganville, these are the 2 towns in Port Vila. We are resilient, but continue to face challenges in terms of coverage. We have also digital wallets that offer moderate reach to our population. We also have the National Bank of Vanuatu that has branches all over the country. There are 30 branches. Vanuatu Post Limited also has 38 branches. Our mobile coverage is around 98%, but a lot of our agents in the islands have liquidity and accessibility issues still. Next slide. So the gaps that continue to exist, the absence of consolidated adaptive social protection database and social registry for targeting our audience, the vulnerable groups, financial inclusion in rural areas is not, doesn't include everyone. We still have the informal workers that are not registered. We have limited merchants that have access to digital payment systems, as well as the literacy to be using the system. And we also have weak prevents and redress mechanisms for beneficiaries at this point. We're also working to improve on these things. Next slide. the opportunities that we can capitalize on through our National Provident Fund that is fully established. We can extend that, as well as that will also register non-members to develop the integrated adaptive social protection database as well, that links with civil registry and BNPF. We also want to leverage on digital wallets as primary delivery channels, and then as well as to enhance our digital and financial literacy for people nationwide. Last slide. And so what we are currently focusing on in phases. So for now, we want to enhance the National Provident Fund system to distribute top-up payments, negotiate with wallet providers. In the short term, this year and over onto next year, we also want to register the non-members. We pilot the ASP database and establish the grievance system as well. Post 2026, beyond 2026, we also want to implement the ASP database and the phase 2 of the national payment system, and scale up our delivery channels as well. Next slide. So moving forward, we just want to strengthen the collaboration of our different stakeholders at the moment. We want to strengthen the working relationship between the Prime Minister's Office, Ministry of Finance, the Reserve Bank of Vanuatu, as well as the Ministry of Justice. We want to develop a ASP architecture with digital payments. We also want to secure disaster risk financing and integrate shock responsive systems, and we'll continue to work with our partners for capacity and infrastructure support. Thank you.
Thanks so much, Maeva. That's really interesting, actually, and amazing hearing Vanuatu's sort of really incremental approach, building on and the opportunities you can see for building on what you've got, you know, starting with your Provident Fund, as you say, but also some impressive figures, you know, 98% of your population captured within the civil registry is quite impressive, actually, and it seems to me like a real opportunity, actually, as well. One of the things I've heard about from Vanuatu is the experience, I think, really stemming from COVID with cash work on a smaller scale, with NGOs in the lead rather than government. Save the Children, I think, did some work in Vanuatu, and I think Oxfam might have done some work in Vanuatu also. Really interesting, Maeva, maybe to hear your reflections on how or what lessons can be learnt from that experience with cash that the government is thinking about as it thinks through social protection.
Yeah, thank you so much, Rachel. So this social protection work has been started by the NGOs, and so the government just picked up from where the NGOs started. So it's good for the country as a whole, and because of the impacts of the disasters that we've been experiencing, but the lead of the NGOs to you know, providing support ahead of the government pushes the government to step up and partner with our well, development partners, but as well as the NGOs, to recognize the efforts in this space and to support through the development of the adaptive social protection policy that we have now. So it's a push that's coming from outside the government, but now the government is taking ownership and responsibility to pick up from that.
Yeah, really fascinating, Maeva. Thank you. We might move on to our third speaker now, who is Ahalotu Palu from the Pacific Catastrophe Risk Insurance Company. Lotu, that's a bit of a mouthful, so I like that people call it PCRIC. It's much easier to say than the Pacific Catastrophe Risk Insurance Company. And I think you're going to speak to us about PCRIC's work and how it contributes to disaster resilience. I know also that Vanuatu has had some experience with PCRIC, so it'd be really, really great to hear how that fits into the picture in the Vanuatu context as well, Lotu. But over to you to talk to us about PCRIC's work.
Thank you, Rachel. I hope everyone can hear me loud and clear from this side. I will speak to you about 4A's, something that I normally use 4A's. The 4A's, the first A is about availability. The second one is accessibility. Third A is affordability. And the last one is accountability. I won't much concentrate on the last A, accountability, but I'll focus on the first three A's. But before I speak on those 4A's, I'd like to go back some 20 years ago, and over the years, and the leaders of the Pacific, they have canvassed the landscape, and a lot of studies, a lot of policy development and policy assessment, a lot of strategy was developed. And through that process, there was the leaders be able to identify that there is a gap in the market, perhaps gap in the market. There's a lack of institutions or lack of instrument, or perhaps maybe you call it financial tools in providing immediate or rapid financings to countries post-disasters. And because of that identifications, from the leaders. And then in 2016, they made a decision to create the Pacific Catastrophe Risk Insurance Company. As you can see, we are just less than 10 years old now. So we are still a baby trying to walk properly, and perhaps maybe running around with diapers. So we're still working to become a dot line, and perhaps maybe in the next few years we'll become much more mature in the work that we are doing in this space. So that was the availability that I was talking about. So because of that creations and then the foresight of the leaders, I mean, if anyone can pull up the two slides that I sent, the first slide, so I can speak to that also at the same time, trying to talk. So with that establishment, the leaders created Pacific Catastrophe Risk Insurance Company as a transfer tool, financial tool. But in front of you guys, if you look at this slide, that's pretty much what I call try to define what is disaster risk financing or what is disaster financing. But as you can see, there are different instruments or different organizations providing disaster financing to the countries in the Pacific. So to avoid making everyone confused with who is providing what and what is PCRIC and what is the other instruments available in the market, I wanted you to just think about it through this slide. The first thing, if you are Minister of Finance, you look into these slides, you have to have some sort of a preparedness financing instrument. You're thinking because you're preparing for disaster. The next one is also you're thinking about risk retention. You're retaining your risk, meaning you redeploy resources. If something happens, if a disaster strike, you can be able to redeploy resources within your budget. And that's what we call retaining your risk. Risk transfer, that's where PCRIC. I mean, if you click to bring up that circle, that red circle. So this is where PCRIC is concentrating, risk transfer. We are a risk transfer, meaning organizations go out to the countries, give them the policy, and if they buy the policy from us, then we take the risk of the countries and ship it over or transfer that to the market. And I meant market meaning reinsurers market. So, and because of the market is continuing to harden every year, getting expensive. So we always emphasize the point of pooling the risk of all the countries in the Pacific. Then we take them to the market to make, to penetrate the market and be able to provide an affordable rate to the countries. When it comes to international financing, that's where you are looking at ADB, World Bank, and other multilateral institutions, maybe bilateral, maybe global initiatives like loss and damage, global shield, through a different initiative like the World Food Program. They also do some work, and other institutions also, they're providing this financing to the countries. And post-event policy options, that's when the government will decide, well, we don't have much resources. Can we do some new taxes or plastic levy? This is when they wanted to fundraise for their own national initiative. But through this, these are the available resources to the countries, and PICRIC is one of these available resources. What is interesting to say here, maybe you can pull up the next slide also. So in this slide here, if you can see this is the disaster three phases. One is relief, the other one is recovery, and the last one is reconstructions. PICRIC is not concentrating on reconstructions. We don't have resources to provide to countries to reconstruct because of damage and loss of their asset or whatever happened because of the cyclone or earthquake. We don't do that. We don't do recovery. What we are concentrating on, we immediately after the disaster, we provide resources for immediate relief. So, and that's the links between what the available functionality or available institutions that we have to this social protections element that we are discussing now. So that's where PICRIC is. I mean, for the benefit of the audience and also ourselves also, this is where PICRIC's comparative advantage. We are only providing resources to countries immediately within 10 days or within 14 days, and I'll talk about Vanuatu later on, but this is what happened in Vanuatu. So we provide the resources immediately after the earthquake within 14 days, and they use the resources to respond, particularly to those who are being affected, as I was told. So that's the availability that I was referring to in my phase A. When it comes to accessibility, yes, we are very accessible. The PICRIC is very accessible. It's all about having a conversation with the countries, identifying and understanding their risk and the layering of their risk when it comes to disaster and climate. And if the priority for them is cyclone or earthquake, then we have the technical conversation with the countries to really understand that. Then we develop the policy or structure the policy accordingly to the technicality or the reality on the ground. And then we can also use that to also speak with the donors, have a discussion with the World Food Program and other bilateral partners or multilateral institutions to also help us in terms of providing resources to subsidize some of their premium, because the market is still very expensive. In some of the countries, they have emphasized the point that they have a limited fiscal space. And because of COVID and because of that nature, we also use that to attract donors' attentions to provide us with resources to subsidize the premium for the countries. So, and that's the element of accessibility. So we are very accessible. It's all through connections. And now we started off with only 3 policyholders. We are now covering about 8 countries in the regions. 10 countries and 2 countries are waiting to come on early next year. We are projecting that within the next 5 years we cover the whole Pacific with providing all that. But there was two issues that I wanted to highlight here also. One of the issue that was, the establishment of PICRIC was also based on what I alluded to earlier on, is to close that gap, is to correct that market inefficiency, but at the same time to also provide educational process. So that's because what I was told from the Pacific leads is there are 2 things. One is the affordability of the premium, and the other one is the lack of understanding of parametric. And maybe for the benefit of the audience, parametric is it's something like, you know how much you pay, and you know how much you're gonna get, which is different from the traditional insurer. The traditional insurers, if something happened, you send an assessor to the countries, they assess it, they determine how much the cost, how much the loss, and they'll determine how much you pay out. For PICRIC, everything is pre-designed. If the country decided to buy a cyclone, we designed it based on the data that they provided to us, based on the reality on the ground, and all pre-designed and pre-arranged the triggers. And if a cyclone happened, and if the triggers are activated, the payment will initiate immediately to make sure that the amount of money is going to the countries in a form of a budget support within 14 days. So yeah, that's the process. Affordability, as I said, when we take the money from the countries, we make sure we share that with the market, have some sort of a bargaining process with the market or negotiations on how much they're going to charge us. And then we give it back to the countries and say, okay, if this is available, if this is affordable for you guys, then you buy it from us. And if it's not, then Pickwick will consider some sort of absorbing the risk for the sake of the country. Normally, sometime when we go to the countries when they don't have money, but if we have resources from the partners, we tell them, okay, I think maybe this is a worth risk to pursue because they will create some sort of an opportunity for us. So that's pretty much the 3 A's that I wanted to highlight there. And coming back to what I meant by what happened with Vanuatu, Vanuatu was one of the pioneer countries for Pickwick, and they didn't renew their policy immediately after 2021, and I think 2022 and 2023. They came back last year, November, 1st of November last year, and they were struck by an earthquake in December 17, I believe. Correct me, my if I'm wrong, but I still recall it was happening 17th of December. So they were paying only 16,000. You can imagine they were only paying 16,000 for that earthquake policy, but we paid them 1.2 million. 1.2 million US. So that was the beauty of the market when we take the risk of the earthquake risk for Vanuatu, pool it with the other countries, and then we take it to the international market, and the market says, oh, this is based on the trigger that we agree upon. So it's about 700,000 people were affected by the earthquake. That's about 50% of the policy payout. So we paid the 50%. If it was more than 700 people affected in Vanuatu by the earthquake, definitely there will be a 100% payout, which is equivalent to 2.4. So it was less than 100,000 or 1 million. So that we only allowed to pay because of the policy 50% of the payout that we pay for Vanuatu. So basically that's from us in terms of the resource that we have. In terms of affordability and in terms of accessibility, we also wanted to have a conversation with the countries to really understand the technicality or the mechanicality behind the product or the service that we offer. And because of that, we're also thinking of providing or rolling out an education program next year. This is a scholarship offering to the countries in the Pacific to really understand, given the fact that most of the leaders they have raised directly to me, and of course through the board and through the members of Pickwick, the lack of understanding of the service that we offer when it comes to paramedic. And most people, even myself too, when I started with Pickwick, I wasn't aware there's something called paramedic. So I learned through this job how to really understand it. So to mitigate that lack of understanding, we were thinking of asking donors to support us with our premium, with our scholarship arrangement with the countries, and we are lucky to receive 1 million euro from the Crop Shield, and that's the money that we're going to use to develop our courses at USB and also to roll out the scholarship. I mean, interestingly, in the USB, they don't have any courses for disaster risk financing. So we are working with them to create this educational platform so that our people in the region can be able to have the opportunity to come and learn or educate themselves about disaster risk finance related to what the service that we offer. So we are hoping that rolling out of the educations and hybrid with capacity building will enhance the understanding on the ground of the service that we offer. And more importantly, to also understand the linkages with other social protection activities on the ground to lessen the confusions. In most cases, I've overheard many people in the Pacific, they say that this is a crowded space. When we're talking about disaster risk finance or climate finance, everybody's saying this is a crowded space. But if you go back to that diagram that I showed you, my face diagram, if you be able to understand it, then you see each of multilateral institution, bilateral or regional organization or regional initiative, they have a different entry point to address. And that's when you start to thinking, oh, it's not a crowded space. But if you understand the entry point of each of them, like the World Bank, the KDDO, and ADB, BIFs, or SPREP or whatever, whoever they are providing within the space, within the ecosystem of disaster risk finance, if you be able to understand it, you see there's no duplications, there is no competitions, but it's all about complementing each other in our interventions of our service to support the countries in terms of building resilience and also in terms of climate change adaptations priorities. I think I'll stop there, Rachel, but those are more like a high-level policy issues that I wanted to share from the establishment of the organization to what we are providing. Going forward, we are thinking it will grow, given the fact that one of the biggest challenge given to us from the country is the affordability of the premium that we offer. But we are lucky that we have received donors who are interested in providing such a premium financing to subsidize the countries, like the World Food Programme also supporting us with $500,000 this year. So I'll stop there before I put everyone to sleep. If there's any questions, I'm here to answer those.
Amazing. Thank you so much, Lotu. Super interesting getting a bit of a deeper understanding of the work that PICRIC does and also how it fits in, as you say, with a lot of different players doing different things at different times along that spectrum from sort of immediate response through to recovery and reconstruction. So really interesting. And thanks also for letting people know about the scholarship that that PICRIC is offering. I did see that on your website, actually, and I think that is it's something that we have been speaking a lot about too, is how do we build that expertise within the region, so that people understand, not only the work that PICRIC is doing in the parametric insurance space, but we face the same issues in the social protection space, and building up local expertise, I think, would be incredibly beneficial. Thanks so much. Can I just say to participants also, if you have questions, you are welcome to put them in the Q&A function. If you are looking for that, that's a separate button down on the bottom of your screen that says Q&A. It has a little question mark in it. Alternatively, you can just raise your hand or unmute yourself and ask a question. I know my mind has been boggling with the amount of questions I have for Jessie, Maeva and Lotu. So if you're like me and you do have questions, please feel free to either ask them now or we can ask them at the end. I might just pause for a minute to see if there are any questions. No, okay, I might keep going. There will be time at the end also. So we might move straight away then to our final speaker, who is Nitesh Chand. Nitesh is one of our co-organisers of this learning series from World Food Programme. And I have to say, he's also the only person who has presented at all three of our seminars in this series. So thank you so much for that, Nitesh. We really do appreciate it. Nitesh is the Program Policy Officer at World Food Programme based in Suva, and he works really closely with the team at PICRIC. WFP and PICRIC signed a Memorandum of Understanding in 2004 aimed at enhancing resilience of Pacific Island countries through disaster risk financing. Really looking forward to learning more about this partnership, Nitesh, so over to you.
Thank you, Rachel, and good day to all. There's been a lot of evidence where money comes actually into countries after a disaster through various disaster risk financing instruments to ministries of finance. In many cases, this money is not spent by ministries of finance during the disaster response and recovery window, simply because governments, they do not have plans as to how those DRF funds are to be used. So my presentation will look at how WFP and PICRIC recently facilitated a disbursement planning exercise for PICRIC payout with governments in the region to address these gaps of unutilized DRF funds. Next slide, please. Apologies.
Is that the slide you're after, Nitesh, or the next one?
This is the one. So WFP is the largest humanitarian organization known, and it knows how costly it is to run humanitarian operations. In the Pacific countries, the context is a bit different, with its own unique challenges and capacities. So WFP in the Pacific does not directly run humanitarian relief operations, but rather strengthen the capacities of existing institutions to reach those most impacted. Hence, the approach in the Pacific is different for WFP. WFP provides premium subsidies to governments for taking up PCRIC macro insurance policies, particularly cyclone policies, as they are climate change related disaster. There are also macro insurance policies for drought, excessive rainfall, earthquakes, and tsunamis taken by countries in the region. WFP premium subsidies enables governments to access larger payouts, which ultimately leads to a bigger humanitarian response by governments towards affected population. For this climate season, 4 countries in the Pacific, namely Tonga, Solomon Islands, Fiji, and Vanuatu, the aggregate total cyclone policy cover is over 12 million USD. And we trust Samoa is also looking at a policy this year. So a large amount of funds has been really secured for cyclone response. In the last month, WFP has worked with 4 Pacific Island countries to plan on how the PCRIC payout can be used to support more people-centric humanitarian response. We know that other DRF instrument funds other specific response, such as infrastructure, that is roads, jetties, and bridges, etc. These planning exercises with governments are called a disbursement plan. A disbursement plan provides series of disaster response intervention options that government can provide to affected people post-disaster. And that would be funded ideally within 14 days by the time when PCRIC macro insurance policy payout funding gets paid to ministries of finance to fund their interventions. Consulting key stakeholders from disaster response clusters and the NDMOs through in-country national workshops has enabled government to put forward their disbursement plans with intervention options such as logistical support, delivery of food and water, provision of medical supplies and wash and hygiene kits, and also cash support to most vulnerable population as government response. Food security and nutrition is WFP's mandate to ensure nutritious food is available to affected people after disaster. And that's why we are coming in to assist with premium support to this insurance. WFP, together with PCRIC, Ministries of Finance, and DMOs have facilitated sessions of these in-country workshops in 4 countries. The disbursement plans also prioritizes the response interventions by allocating certain percentage of funding from the total payout to certain interventions. It also outlines the financial flows and identifies the procurement needs of these response interventions by identifying all agencies that will be required to undertake these procurements for logistical services, food and water, medical supplies, and even the FSPs for cash distribution. There's a SOP within the disbursement plan to guide governments with processes involved for their entire action. The disbursement plan has a risk matrix and also monitoring and evaluation framework. Most importantly, the disbursement plan unblocks bottlenecks as we see during times of disasters that the national governments are unable to do procurement and provide relief to the people. ASP complements other interventions. Next slide, please. So one of the most cost-effective, efficient, and timely response to meet humanitarian needs is adaptive social protection intervention. With PRP payout available after 14 days, governments will be able to disburse cash payments as top-ups to most vulnerable and affected population through either a vertical top-up or a horizontal expansion to government's existing social protection schemes. Tonga and Fiji, for instance, have included cash as a response intervention into their disbursement plan. Vanuatu has a strong interest, however, the systems and capacity may not be able to deliver at this stage as a humanitarian response, as you have heard from Maeva earlier on. Solomon Islands is also not ready for adaptive social protection cash response yet for this cyclone season. However, they'll be looking or considering that maybe in the future. On the money out, the funding from PRP is received by the 14th day with Ministry of Finance. So once these response interventions have been decided and agreed by government, Ministry of Finance then channels these fundings to ministry responsible for social protection for a cash payout. Ministry of Social Protection defines the transfer value and identifies the potential beneficiaries through either targeting of affected people or a blanket selection of all communities that are affected by the disaster based on the available funding allocation they have. The cash top-ups would be provided in the case of Fiji and Tonga through the existing social protection platform for the government, where during peace times, monthly social protection assistance is provided. The PRP macroinsurance serves to be more sustainable financing source of adaptive social protection as a pre-arranged financing for governments and potentially one risk layer within the DRF space. I would like to give a real example of Grenada in 2024, where they did not have a disbursement plan before a disaster response. Grenada is a country all the way in the Caribbean. Of course, that's very far away and a different context to the Pacific. But the experience is worthwhile sharing. And I'll share the experience of Cyclone Beryl, as some small island states may resonate here in the Pacific. On 1st July last year, Cyclone Beryl ripped through the Atlantic, hitting multiple islands in the Caribbean at its strongest. This was the earliest Category 5 cyclone to hit Caribbean in history. Months ahead and out of a season of when actually big cyclones arrive, that is between months of August and October. WFP's multi-country office in the Caribbean topped up Caribbean Catastrophe Risk Insurance Facility called CRIF, which is similar to PCRIC here in the Pacific, insurance policy for Grenada for the first year in 2024. Because Grenada was newly country added to WFP to provide premium subsidy in 2024 in the Caribbean, they had not at that time finalized the disbursement plan when the policy was purchased. That is not really a best practice, but given it was the first year, it's not unusual. Unfortunately, this came to have big repercussion because Cyclone Beryl hit the region so early in the season, and because Grenada hadn't prepared a disbursement plan, they had to start from scratch in designing the CCRIF payout response. CCRIF paid the insurance claim within 2 weeks after the cyclone had ended. However, it took months for these funds to begin flowing flowing to the affected people. Without a well thought out disbursement plan in place, the government had to make every decision about how to respond during the chaos or the aftermath of the cyclone. They decided to actually build a bespoke social protection program called BRISP, Berlin Beryl Relief's Income Support Program, which provided cash transfers to people, those people whose livelihood had been impacted by Cyclone Beryl. Now, due to complexity in setting up this system from scratch, including setting targeting criteria, transfer values, inclusion and exclusion criteria to avoid duplication with other social protection schemes, etc., the first transfer did not reach to people until January 2025, 6 months after the storm. So this shows how important a disbursement plan is and risk of not having one. This example actually gives us a case where a social protection was set up after a disaster, and the assistance did not reach to people in timely, and we've just seen that it actually reached up to them after 6 months. So the importance of having a disbursement plan and the interventions identified prior is really essential, and that's what we're doing differently here in the region with countries to have disbursement plans designed prior, and then they have the options to actually really implement the response as soon as the disaster hits and the money is within the Ministry of Finance coffers. Thank you. I'll probably stop here to take questions.
Thank you so much. What an interesting collaboration that is between WFP and PCRIC. Really great to hear more about that, actually. I know development partners like the Australian government have used those existing social protection systems in Tonga and Fiji, as you say, to get funds out to people following cyclones and the volcanic eruption in Tonga. But really interesting hearing how that same mechanism can be used for these insurance funds too. That's a really exciting and a really important way, as you say, of making sure that these funds coming in are dispersed in a well thought out and timely manner. So that work that WFP is doing in supporting countries with the plans in coordination with PCRIC is really exciting. That brings us to the end of our actual presentations. We do have about 10 minutes though for questions. I might ask first if anyone has any questions for Nitesh before we move on. There's a question in the Q&A box as well that I will ask. I'm not certain who I will direct it to. It's a sort of an overarching question, but we might throw the floor open. If you do have a question, anyone who's participating, please do raise your hand and we will unmute you and you can ask that. Or alternatively, put your question in the Q&A box. So maybe there's sorry, Nitesh, there's one that's come in the chat actually. Someone would like to understand whether countries like Jamaica and Haiti have any coverage like this after cyclones. I don't know, after Cyclone Melissa, sorry, I don't know who can talk to that.
Rachel, let me come in to answer the questions because it's related to what we're doing. I think for the benefit of the audience, there are only 4 risk pool instruments in the whole world, which is PICRIC for the Pacific and CRIF for the Caribbean and ARC for Africa and C3 for Southeast Asia. Yes, there was a payout, and each of these regions, we can't provide something from the Pacific because they have their own facility like us. And CRIF, the Caribbean facility, which is the same instrument as us, they provided 70 million to Jamaica within 14 days. But if you look at it, I was told there was less than 5 million of the premium that the country was paying, but they received 70 from the market. So that's a quite significant amount of payout that the instrument have paid to one country in the Caribbean. So yeah, as you can see, if the countries, I mean, PICRIC is scalable. If the countries be able to pay more in the premium, and then we'll be able to subsidize, yes, they will receive it. When we discussed this with the former finance minister of Fiji, we indicated to him if they be able to pay 5 million for their premium, they will be able to receive in between 70 to 75 million from the market, because we're taking the risk of the countries. 70% of the risk that we are taking is transferred to the market. We only retain 30%. So as you can see, there's a humongous amount of money coming out from the market. So, but it's a matter of understanding of, all this, what we're doing is all about being prepared. But if the countries really understand, understand or they are aware of the risk and whether the risk that they will go to the market and whether the risk they retained, I'm sure there are other instruments that they'd be able to step in and help, post disaster, like what happened in Jamaica and what happened in Vanuatu. And imagine in Vanuatu, they were paying $1 million for that earthquake. I'm sure they will be receiving more. They were paying only 16,000, but they received 1.2, and that was the price from the market. So yeah, thank you.
Yeah, amazing. Lotu. Nitesh, there is a question. There is one other question that's been in the chat for a while. I will get to it, but there is a question that's come up directly related to your presentation, Nitesh. How do the World Food Programme and governments decide on the use of cash over other services or provisions?
Thank you. So there's basically this disbursement planning process whereby consultations are done with all the response agencies, all the agencies basically rather who's providing response in the country. So a list of menu options are decided as to how these funds will be used towards, and one of them is cash. But really, the decision lies with the national governments, how they prioritize the interventions. If they identify food distribution as the priority and not the cash, then they will go ahead with the intervention of distribution of cash and food and not cash. So in that case, the decision lies with national governments to identify the interventions that they choose, either it be cash or any other services for that matter. So that's my response to that.
And Nitesh, just building on that, where you have governments where they do have existing social protection systems, is there, I can imagine it's very hard if you don't have existing social protection systems to be thinking through ASP or ASP options or cash options. But where they exist, do you see that that's an attractive, governments are favouring that approach of cash, or is there still some reluctance? Even in countries where they do have mechanisms that they could be deploying cash through.
Thank you, Rachel. Actually, the governments favor cash over another traditional response because these cash top-ups are quite efficient, cost-effective, as well as timely. If you see in comparison to food distribution, for example. So governments, they do have a social registry in place. They identify the beneficiaries that basically needs to be assisted. And through that targeting exercise, they are able to provide a rapid cash transfer to the social protection beneficiaries. And as I've said, it's quite cost effective and timely, basically providing cash into the hands of the people. So yeah.
Right. Thanks, Nitesh. The question that has been sitting in the chat, I might throw this out to the whole panel actually. Whoever can answer, please do jump in. The question is, where would disaster recovery financing lie or be categorized, especially if it's geared more towards reducing risks or enabling building back better actions in the long term? Jessie, I guess this sort of links to your discussion of the sorts of financing and what they're used for. I don't know if you want to start, but others, please do jump in also.
Yeah, thanks, Rach. I think if we sort of, think about where disaster recovery financing sits, it really depends on what kind of recovery we're talking about. So traditionally, disaster risk financing, what we see through mechanisms like PICRIC, as Lotu mentioned, is designed to provide that rapid liquidity sort of right after a shock. And it covers that immediate relief phase, keeping people fed, sheltered, supported in those first weeks or months. But then sort of when you move into recovery, things start to shift. So if the goal is to simply restore what was lost to get the infrastructure and livelihoods and services back to pre-disaster levels, that still falls within disaster risk financing space. But once recovery efforts start aiming to reduce risk or to build back better, for instance, reconstructing homes or, to be cyclone resilient or restoring mangroves or investing in adaptive livelihoods, then we're really crossing into the domain of climate risk financing or adaptation finance. And I think just in that slide that we presented earlier, we're sort of thinking about how you make that distinction between the different buckets of financing. It's a bit of a tricky one. And I think in some instances, the lines are slightly blurred. But I'd be really interested to hear others' perspectives as well. Thanks.
Any other thoughts on that from any other panelists? There are two other questions that I would like to get to. It might mean that we run 1 or 2 minutes over, if everyone's okay with that. But first of all, anything else to add to that, Lotu? No. Okay. The next question we have is, what are the panelists' experience of data sharing between National Disaster Management Officers and the ministries responsible for social protection that enable these programs? Are there specific good practice examples on this topic? Jessie, again, I wonder, or Nitesh, I wonder if either of you have experience, or Maeva, maybe in your experience in Vanuatu would be interesting. Should we start with you, Maeva?
All right, thank you for the question. As I've said, Vanuatu is in the early stages of social protection wave. So we are still working on the institutional arrangements of things. where the adaptive social protection will likely to be housed. But we're still working with, the different stakeholders to come up with the possibility of having ASP or in general social protection policy to be sitting at. So as we speak, we also have the National Recovery Committee sitting at the same time to discuss the implementation plan of the ASP policy, and also to discuss. But because we have been experiencing working in silos for the longest time, we're trying to improve on that, to have more collaboration between the different stakeholders to make this effective and workable for the context of Vanuatu. But I can't say much at this point because we're still, in my presentation, I said, in the future, we will, try and pilot the database that we're currently working on and then see how these different mechanisms work together to efficiently roll out ASP. Yeah.
Jessie, what about from experiences in other countries where you or P4SP have worked?
Yeah, thanks, Rach. I mean, I think, that sort of data sharing between NDMOs and social protection ministries is still evolving, but we are seeing some promising examples. In Fiji, MWCSP and NDMO now exchange beneficiary data during disasters, and that's sort of allowed some of these rapid top-ups that we've seen. In Tonga and Samoa, as I understand it, sort of data flows through the cluster system. So with ministries using welfare and protection data to inform some of the humanitarian cash responses. And so I think, the key takeaway is that good data sharing isn't just about technology. I think it's about trust and clear agreements and shared protocols. And a lot of that work is done sort of at the front end, as Nitesh mentioned in his presentation as well.
Thanks, Jessie. Yeah, that government coordination, as so many people have spoken to today, is really important to think about, and it's hard. Everyone's got their own mandate. Departments have their own mandates, and they're incredibly busy. But that data sharing and coordination across ministries is really critical. The final question, Nitesh, relates to your presentation again. Does WFP have criteria that you provide governments on how cash transfers should be used, or is it open to recipients to determine how they use the cash that they would receive following a disaster?
Thanks, Akosita, for that question. So WFP really does not dictate here, because the funds actually are channeled through the national governments. So we understand the governments provide multi-purpose cash to the beneficiaries, and the fundings can be used. That funding can be used by the beneficiary to buy whatever basically is needed for them in those circumstances. So usually they can use it towards maybe buying of essential items or hygiene kits or whatever is required based on the vulnerable needs of the community. So there's no restriction. It's a multi-purpose cash. Thank you.
Great. Thanks, Nitesh. That brings us to the end of our questions and also to the end of our session. Thanks, everyone, for the questions that you've raised. I've certainly found it really interesting today, and I hope you have too. A huge thank you to our speakers and panelists, Jessie Doyle, Maeva Magmui, Lotu Palu and Nitesh Chan, and also to our colleagues at the Pacific Island Forum Secretariat for hosting the webinar today. Today's session has really highlighted, I think, how social protection and disaster risk financing contribute to shock response and play an important role in helping countries in the Pacific strengthen their resilience in the face of increasing climate and disaster risks. And listening to that example from Maeva when she talked about Vanuatu's experience of multiple cyclones and compounding factors with COVID and cost of living, it really brings to light how important it is to think about that continuity or the continuum between disaster response through to ongoing and routine social protection and how they fit together, and the important role that insurance plays in that. A recording of this session, as I said earlier, will be available soon on the Pacific Resilience Partnership YouTube channel. You can also find the previous 2 sessions there if you're interested in going back and listening to those. Again, panelists, thank you. Thank you to our participants for joining today. I hope you have a really excellent week ahead. Goodbye and Vanaka Vakalevu.
Thank you, everyone. Thank you. Thank you for having us.
Thank you.
Thanks a lot, everyone. Bye.
Thank you, Rachel. Awesome facilitation.
Thanks so much, everyone. That was great. That was great.
Yeah, it was great.
Thank you, Thomas, Rachel, for hosting.
My pleasure, as always. Thanks everyone for speaking today. It was really excellent. All right, I'll let you all go. Bye.